Hey there, parents and caregivers. Welcome back to Little Kids Lessons. Today, we're diving into a topic that's near and dear to every new parent's heart: baby sleep. More specifically, we're going to answer the question, why do babies cry in their sleep? If you've ever been startled awake by your little one's cries, only to find them still fast asleep, it's a common experience, but it can be pretty confusing and even worrying for new parents. So, let's break it down. First off, it's important to know that crying during sleep is totally normal for babies. In fact, newborns spend about half their sleep time in REM sleep, also known as active sleep. During this stage, babies might twitch, jerk, move their mouths, or even cry out. It's all part of their natural sleep cycle, which is much shorter than in adults. Another reason babies might cry in their sleep is hunger. Those tiny tummies need filling every few hours, and crying is their way of letting you know it's chow time. Breastfed babies usually wake up every 2 to 3 hours for a feed, while formula-fed babies might go 3 to 4 hours between meals. Sometimes, babies cry in their sleep because they want to suck. Sucking is a natural soothing mechanism for infants, so if they doze off with a pacifier and it falls out, you might hear some fussing. The startle reflex, or Moro reflex, can also cause babies to cry in their sleep. This innate reflex causes babies to throw out their arms and legs when startled, which can sometimes result in them accidentally bonking themselves and waking up upset. Discomfort is another common culprit behind sleepy cries. A wet diaper, a room that's too hot or cold, teething pain, or even a barking dog next door can all disrupt your baby's slumber. Lastly, overtiredness can lead to crying during sleep. It might seem counterintuitive, but an overtired baby often has a harder time settling down and staying asleep. That's because their body is producing cortisol, a hormone that fights fatigue but can also interfere with sleep. So, how can you tell what your baby's cries mean? Well, a soft whimper usually indicates they're transitioning between sleep cycles or are mildly uncomfortable. Sudden, loud cries that don't stop after a few minutes often mean they need something, like a diaper change or a feed. And a high-pitched, inconsolable wail can signal pain or serious discomfort. Now, you might be wondering if babies have nightmares that cause them to cry in their sleep. The good news is, they don't. Infants don't start dreaming until around age 2, and even then, their dreams are more like simple snapshots than the complex narratives adults experience. Nightmares and night terrors usually don't start until the preschool years. So, what can you do to calm a crying baby in the middle of the night? First, don't rush in at the first whimper. Give them a few minutes to settle themselves. You might be surprised at their self-soothing skills. If the crying continues, try turning on some white noise. The steady, soothing sound can help babies tune out disturbances and fall back asleep. Swaddling can also work wonders by suppressing the startle reflex and making babies feel snug and secure. If you're using a pacifier, try gently tugging on it while your baby sucks. This little bit of reverse psychology can encourage them to suck harder and keep the pacey in place. Make sure the room is a comfortable temperature. Between 68 and 72 degrees Fahrenheit is ideal. And when you do go in to soothe your baby, keep the interaction low-key. Soft voices and dim lights will help them settle back down more easily. If hunger seems to be the issue, consider a dream feed. This is where you gently rouse your sleeping baby and offer a feed before you go to bed yourself. The goal is to top off their tank, so to speak, and help everyone get a longer stretch of sleep. Incorporating soothing techniques into your baby's bedtime routine can also help minimize night wakings. Swaddling, white noise, and gentle rocking or swinging can all signal to your baby that it's time to wind down and drift off. Lastly, watch for signs of sleepiness and put your baby down to rest as soon as you spot that first yawn or eye rub. An overtired baby is much harder to settle, so catching them before they get to that point is key. Remember, every baby is different, and it can take some trial and error to find what works best for your little dreamer. Be patient with yourself and your baby as you navigate this new world of sleep together. That's all for today's lesson on why babies cry in their sleep. We hope you found it informative and reassuring. If you did, be sure to like this video and subscribe to our channel for more parenting tips and tricks.